Hello, everybody. This is June 26th, 2023, and we're going to start our AHIP training with Module 1. So I am going to share my screen, and this is so that everybody knows how to get into AHIP. Now, if you have not paid for AHIP yet, you're not going to be able to actually get into AHIP. But once you go in through any of the carriers, and this was a problem for some of you because I thought we would all be able to go in through Humana. I wasn't able to go in through Humana because Humana doesn't open, I think, until the 28th. So you can't get in through Humana. So I went in through WellCare. And that's how I am able to access AHIP with the discounted price. So you go to a new tab, and can everybody see my screen? If you can see the screen,
Yes.
Just say, okay, let me know. Okay, thank you. So we're gonna type in AHIP. Gonna go to the home page of AHIP. And I gotta move this out of the way because I'm gonna click login. Now, because I've already gone in through WellCare and logged in, and the training that I'm looking for is Medicare. You need paper and pencil, paper and pen, or some other method of taking notes. You're going to go to Medicare Plus Fraud, Waste and Abuse Training for Agents and Brokers. That's where you're going to log in. And let me minimize this. Okay. So this is what it looks like. Online course. And once you go in for the first time, if you're interested in reading why you should do all this, then please do. But let me tell you now why it is important that you do AHIP and why it is important that you do it early. This year, unlike other years, carriers, CMS, FMOs, journal agencies, everybody is moving faster to preparing for AEP. So what that means is the resources that are going to be available, the places where you can be, the retail stores that are available, the retail slots that are available, the seminar slots that are available, the marketing dollars that are available are going to be available sooner. You are not considered for any of that if you have not certified with the carriers. So our resources come to the FMO, down to me, down to you, or wherever you are connected earlier this year. And when that happens, you need to be certified with the carrier in order to enjoy those resources. So I want you all to be ready. I want you to be prepared. That's why it's important. Do your AHIP, get it out of the way. As the carrier certifications come in, take the time to do them. I know that you're still working. I recognize that you need to work, you need to sell, but you need to also do this, because if you are not certified with the carriers, you cannot be considered for certain resources. And if everybody gets all the choice spots and everybody gets all the choice resources, and you don't certify with the carrier until August, you may not be in a position to get what you really, really need. I hope that's clear. If there are any questions, you can certainly reach out to me and ask me. So what you're going to learn in this AHIP is you're going to learn about the basics of Medicare. You're going to learn the different types of Medicare Advantage and Part D prescription drug plans. You will learn the eligibility and coverage, the non-discrimination training. You will learn Medicare Advantage and Part D requirements. Along with the AHIP, training for Medicare is the fraud, waste, and abuse. So you will also need to complete that as part of the AHIP. Your AHIP is not complete until you have done Medicare final assessment and passed, and you have completed the fraud, waste, and abuse and passed. So just remember, you've got 2 things to do. So if you do the Medicare piece and you haven't done fraud, waste, and abuse, you're not done yet. So you're ready to get started. When you go into that login page, this is what your login is going to look like. It's going to be your NPN or your email, however you set up your username and your password. And then you're going to log in. If this is the first time that you're doing AHIP, then you have to register. So these pages give us instructions on the certification, which it's not my intent to read to you line by line. But you're going to go to my certifications, 2024 AHIP Medicare training, and mine, because I've done it before, is recertification. Is there anybody here who is doing AHIP for the first time? Put it in chat and I'll see it when I get back over to chat. So we are starting with module 1. So when we'll click on module 1, it'll open. Now every module is going to have, over on the left-hand side, download content materials. So you can download the slides in a PDF for this entire module right there. If you choose to, it's not a bad idea. Download them on your desktop. You'll have them there. If a question comes up while you're doing the testing, the final testing, and you need to do a Control F, you can do that within the module that you think it applies to and look for the answer before you actually answer it if you're not sure. Okay, Gia is the first time and Lisa is the first time AHIP. Okay, so this is an experience for both of you. You will find, I think, as we go through this, now, if you have not paid your $150 to get into AHIP yet, when you do it, it's all going to be the same. It's going to look just like this. So you will at least have gone through module 1. You still looking at my screen? Everybody can see the screen? If at some point the screen is not showing, let me know, please. Okay. So module 1 is an overview. It's an overview of Medicare program basics. So the basics that you're going to know, because if you've did the licensing, you know a little bit about it. For those of you who are already working, you know the basics. So we should be able to get through module 1 pretty quickly. So start course. Every module is going to have these navigation instructions. The red 01 is previous and next at the bottom of the page. You can go backwards or forward, but you can't go forward through the course just one page after the other. You have to actually read the page. Students are required to review each slide. users can view the current slide and any slide they previously viewed, but will be unable to skip or jump ahead within the menu. So you can click the menu icon to expand or collapse the table of contents. And of course, I just told you, you could download the slides on the left. So here's your previous and your next. So we're going to go next. And I'll have to keep sliding my screen so that you see the full page. The first one is terms and conditions. And it's all the legalese that you agree that this is a copyright, you know it's a copyright, you know how to use it prudently. It's not something that you're going to copy and then send off to somebody. It's intended to provide guidance in identifying the factors for consideration of the basic rules and regulations governing coverage, eligibility, marketing, and enrollment for Medicare, Medicare Supplement, Medicare health plans, and Part D prescription drug plans. And it's not intended to be legal advice. We're not attorneys. We don't give legal advice. There are certain ways that we say things when we're talking to a Medicare beneficiary. We use words like may, perhaps, could be. You know, you're not using definitive, definite statements sometimes, because we're not legal people and you do not want to give out information that's incorrect. The learning objectives for Module 1 is to learn the different ways to get Medicare benefits, the eligibility and coverage under Part A and Part B, original Medicare premiums, help for beneficiaries with limited income, and combining original Medicare and Part D. Those are the 5 things that you should learn in Module 1. So Module 1, Medicare Program Basics, original Medicare eligibility, enrollment, entitlement, and premiums, help for individuals with limited income, Medicare Part A benefits and original Medicare cost sharing, Medicare Part B, original Medicare, and Medigap coverage. So Medicare, as we all know, is a federal program. And Medicare recipients are eligible because of age or because of disability, and they've been collecting Social Security disability, or in the case of Lou Gehrig's disease or end-stage renal disease, they're eligible for Medicare. So that's how you become eligible for Medicare. It does not take into consideration income. However, individuals may pay higher premiums based on income, and low-income individuals may be eligible for additional assistance. So people with higher incomes than the standards that are set by Medicare every year will pay higher premiums for Part B and higher premiums for Part D. People with lower income, the people that you may know as being eligible for low income subsidy, may not pay a premium at all. So individuals can receive their medical coverage directly from the federal government, which pays for services on a fee-for-service basis, and this program is known as Original Medicare. Or they can get Medicare coverage through a private health plan, and those would be your Medicare Advantage plans. Individuals must receive their Medicare Part D for David outpatient drug benefits through a private health plan. Medicare nor Medicaid insures prescription drugs. Medicare coverage is known by the part of Medicare law under which it's authorized. So there are 2 pieces to basic original Medicare. Part A Part A refers to hospital insurance benefits, but Part A also covers inpatient care, skilled nursing facilities, rehab facilities, and hospice. Part B refers to supplementary medical insurance benefits. So Part B, you know, as a broad range of outpatient services such as physician's care, could be in the office visits, or it could be the surgeon who does the surgery, who bills as the surgeon. And Part B also are certain drugs that are administered, or injections that are administered by physicians, such as chemotherapy drugs and radiation drugs. Also, certain vaccines and intravenous medications are covered under Part B for boy. Part C is also Medicare piece that regulates and authorizes Medicare Advantage plans, which cover both Part A and Part B benefits, except for hospice. Anyone who has a Medicare Advantage plan who has a hospice diagnosis, their services for hospice is covered by original Medicare. So reverts back to original Medicare. Individuals enrolled in Plan C or Part C, or a Medicare Advantage plan still get hospice benefits, but their hospice benefits are paid by original Medicare. Part D is the prescription drug benefit that you can only get through insurance plans for self-administered drugs, such as those picked up at the pharmacy and taken home. And this Part D is regulated by the Medicare prescription drug plans. This is a new one. Did anybody know? Did everybody know there was a Part E? E for every, E for I don't know what E stands for, but this year we have a new Part E. This is the first time I've heard of Part E. There's also a lesser known Part E of Medicare law that regulates other miscellaneous programs, including Medicare cost plans, which also cover Part A and Part B benefits. Medicare cost plans are only covered in a limited number of states and are most frequently found in rural areas. Is there anyone here who currently has a Medicare cost plan as a part of your Medicare offerings? We do not in my area. Part E also is what Medicare refers to as the Medicare supplemental insurance, the Medigap plans that are from insurance carriers. And it's the program for all-inclusive care for the elderly called PACE. So those are other ways to have Medicare. Not most common, however, because they're not in all states and not in all areas. But as a part of your test, you'll have at least one question on there about PACE and about Medicare savings. There are different ways that beneficiaries can choose to receive their Medicare coverage. This, I'm sure everybody here knows. You can have original Medicare, which is the red, white, and blue card, Part A and Part B, and that can be combined with a Medicare supplement or Medigap plan and a prescription drug plan. So the Medicare supplement plan that works with original Medicare is directly from an insurance company, and the individual chooses if that's what they want to do, because they are paying the premium for it. So it's their choice which company, it's their choice which of the Medicare supplement plans they want to choose. With the prescription drug plan, also from an insurance company, putting those three pieces together, they'll have a full comprehensive coverage, but the Part D is going to have a premium as well as probably deductibles and copays. So one way is an individual can have original Medicare, a supplement, and a Part D. Or they could have a Medicare Advantage plan with or without a Part D benefit. And anyone who might not have a Part D benefit may be, and a good example of that might be someone who uses the VA for their benefits as well as Medicare, and they have an HMO or a PPO that does not have a prescription drug plan because they have TRICARE for life and their prescriptions are covered through TRICARE for life. Another individual who may want Part C Medicare Advantage plan without prescription drugs might be someone who is a part of a union and their prescription drugs when they retire is a part of the union package that they receive, like Teamsters. So they don't need a prescription drug plan from Medicare or through a private insurer because they have a group prescription drug plan. An individual may choose that they're only going to have a Medicare prescription drug plan with their original Medicare. They're going to self-insure any of the copays, coinsurance that's within original Medicare. Medicare cost plans, PACE plans, and then of course Medicare, Medicaid is another way that people can get Medicare. This chart sort of repeats the same information. So there are different ways to have Medicare coverage, and it also shows where the benefits can match together. Are there any questions on this before we go any further? I got a smart group. Okay. Original Medicare eligibility, enrollment, entitlement premiums. So now we know original Medicare is Part A and Part B. Part A benefits include inpatient hospital, skilled nursing, hospice, and home health services. Part B includes outpatient and professional services, such as those provided by a doctor or a non-physician professional, such as a nurse practitioner or physician assistant. It includes clinical lab services, durable medical equipment, prevention services, and other outpatient medical services. That's Part B. Eligibility for Part A and B. You're eligible for Medicare Part A and B when you become age 65 or older, or you're under 65 with certain disabilities or health conditions, including all who get disability benefits from Social Security or railroad retirement for 24 months, individuals with ALS, often referred to as Lou Gehrig's disease, or individuals who have end-stage renal disease. You must be a United States citizen or be either a United States citizen or an alien who's been lawfully admitted for permanent resident and has been residing in the United States for 5 continuous years before the month of applying for Medicare. Some people are enrolled automatically. So someone who is collecting Social Security payments, when they become 65, they will automatically be enrolled in Medicare Part A and B after they've received, if they're under 65 and they're receiving Social Security because of disability, after they receive those payments for 24 months, they will be automatically enrolled in A and B. Individuals with Lou Gehrig's disease will get Part A and Part B automatically the month their Social Security disability begins. Individuals living in Puerto Rico are not automatically enrolled in Part B. They must sign up for it. Individuals who are already collecting Social Security, because you can start to collect Social Security non-disabled at age 62. So someone who is already collecting Social Security or railroad retirement benefits will automatically be enrolled on the first day of the month that they turn 65. The exception is if their birthday falls on the first of the month, then their Part A and Part B effective date is the first of the previous month. Other individuals outside of the ones that we just covered will have to sign up when they want to be enrolled in Parts A and B. So individuals who are close to 65 but are not getting benefits from Social Security or railroad retirement may sign up during their initial enrollment period, which begins 3 months before their 65th birthday, including the month they turn 65, and ends 3 months after their birth month. Individuals with end-stage renal disease may sign up for Medicare at any time. However, the date on which their Medicare coverage begins is usually the 4th month after dialysis treatments begin, but may be earlier if certain conditions are met. Individuals eligible for premium-free Part A can also sign up for Part A anytime after they turn 65. Their Part A coverage starts 6 months back from when they sign up, but cannot start earlier than the month they turn 65. If they have not signed up by the time they apply for Social Security, then they will be automatically signed up for Part A, and the coverage will be retroactive for 6 months. People who will get Part A free are those people who have worked and paid into the Medicare system for 40 quarters, 10 years, doesn't have to be consecutive, or their spouses have worked and paid into the Medicare system. If an individual enrolls during any of the first 3 months of their initial enrollment period, their coverage will start the first of the month of eligibility. If an individual enrolls during their initial enrollment period in the month they become eligible, coverage will start the month after they enroll. Premium-free Part A coverage will be retroactive to the month they turn 65. So an individual who will be 65 in July could have enrolled April, May, or June for a July 1st effective date. That same person can also enroll in July for an August 1st effective date. Their Part B will be August 1st, but their Part A will be July 1st. If an individual enrolls during any of the last 3 months of their IEP initial enrollment period, their coverage will start the month after they enroll. Premium-free Part A will be retroactive to the month they turn 65. So the example that I just gave would be the same for 3 months after the birth month of July, and Part B would be effective the following month of the application date, but Part A would be effective July 1. individuals who do not enroll in Part B or Part A, or when they are first eligible, can enroll during the general enrollment period. And this is a change each year from January 1 to March 31. In the past, when they enrolled during the general enrollment period, the coverage was effective July 1. Now, if they enroll during that general enrollment period, coverage begins the first of the month following the month in which the beneficiary enrolls. So if they enroll in January, it's effective February. If they enroll in March, it's effective April. Individuals who have group health coverage will always have a special enrollment period that occurs during the 8-month period immediately following the last month that they have group coverage. So someone could not decide what they're going to do right away when they leave an employer plan, but they have 8 months in order to get the coverage without penalty. Individuals who are eligible for premium-free Part A may sign up at any time. New special enrollment periods for 2023 and beyond. These are new special enrollment periods. Individuals impacted by an emergency or disaster allows eligible individuals or their authorized representative who missed an enrollment because they were impacted by a disaster or other emergency as declared by federal, state, or local government to enroll up to 6 months after the end of the emergency declaration. So that differs by state. It can differ by local government. It can, differ by federal government rules. Individuals impacted by a health plan or employer error applies where an individual can demonstrate that the employer or health plan, and that includes you, brokers or agents, materially misrepresented information relating to enrolling in Medicare at a timely basis at the right time. That individual may enroll up to 6 months after the individual notifies Social Security of the error. Formally, these are some other new special enrollment periods for 2023 and beyond. Formerly incarcerated individuals. The special election period allows eligible individuals to enroll following their release from correctional facilities up to 12 months post-release. Such individuals may choose between retroactive coverage back to their release date, not to exceed 6 months, or coverage beginning the month after the month of enrollment. If an individual selects retroactive coverage, they must pay the premiums for the retroactive covered time period. Individuals whose Medicaid is terminated, the special election allows eligible individuals who missed a Medicare enrollment period to enroll in Medicare after termination of Medicare. And again, they have the choice to choose retroactive coverage, but no earlier than January 1, 2023, or coverage to begin the month after the date of enrollment. Individuals with exceptional conditions, that special election would allow CMS on a case-by-case basis to grant a 6-month special election to an individual when circumstances beyond the individual's control prevented them from enrolling during an initial enrollment period, a general enrollment period, or a special election period. An individual is entitled to Part A if they're eligible for premium-free Part A, or if the individual has enrolled in Part A and continues to pay the premium or have the premium paid on their behalf. An individual must enroll in Part B and remain enrolled in Part B by paying the premium for Part B or have the premium paid on their behalf. To get Part C plans, the Medicare Advantage plans, these are the eligibility requirements. Person must have Part A, entitled to Part A, and enrolled in Part B, and reside in the Medicare Advantage area. I think I couldn't click the X, that's why I did that. To be eligible for Part D, a person must be entitled to Part A and or enrolled in Part B and reside in the Part D plans service area. So they don't have to have Part B to be eligible for prescription drug plan. They could have just Part A or B. For cost plans, an individual must be entitled to a Part A and or enrolled in Part B. If they're not entitled to Part A, they will not have coverage of Part A benefits under the cost plan. They must reside in the plan's area. Medicare and Medicaid, the individual must have both Medicare and Medicaid, must meet eligibility requirements specific to the state, and reside in the plan area. For the PACE plan, the person must be 55 or older, be certified eligible for a nursing home care in the state, be able to live safely in a community setting at the time of enrollment, reside in a PACE organization service area, meet any additional program-specific eligibility conditions. Hang on one second. Okay. Eligibility for people with end-stage renal disease. Individuals eligible based on end-stage renal disease generally lose eligibility 36 months after the month in which the individual receives a kidney transplant, unless the individual is eligible for Medicare on another basis, such as age or disability. However, beginning 2023, such individuals may remain enrolled in Part B only, but solely for coverage of immunosuppressive drugs if they have no other health care coverage that would cover the drugs. People with kidney transplants have to have these drugs for life. So those would be covered under Medicare as a Part B drug. They're injectables. So an individual who may come off of Medicare because they have a transplant may be able to keep their Part B coverage starting in 2023. That's new. Part A premiums, Medicare Part A premiums. Most people are eligible without paying a premium, and that's because they worked and they have paid into the Medicare tax systems for at least 10 years. All individuals eligible for Medicare due to disability are eligible for premium-free Part A. For those individuals who do not automatically qualify for premium-free Part A, the monthly Part B premium, Part A, I'm sorry, premium in 2023 is $506 for individuals or their spouses who paid Medicare taxes for less than 30 quarters. $278 for individuals or their spouses who have paid between 30 and 39 quarters. Individuals who are not eligible for premium-free Part A and those who don't buy Part A when they are first eligible may pay a late penalty of up to 10% unless they enroll during a special enrollment period. They will have to pay the higher premium for twice the number of years they could have had Part A but did not sign up.
Hey, before you move on, I had my hand raised.
Oh, I'm sorry, I didn't see it.
That's okay.
Okay, what's your question?
The previous slide, I think it was, when it was talking about premiums for people that didn't pay in enough quarters. Is that $506 a month?
Yes.
Okie dokie. Thank you, ma'am.
That's why you rarely see people who don't have Part A pay for it. Unless they, qualify for Medicaid and then they get it paid that way. Beneficiaries enrolled in Part B must pay a monthly premium. In 2023, the standard monthly premium is $164.90. Most people pay the standard monthly premium. However, there are going to be some people whose income is greater than the standards, and I don't know if the next slide's going to give us those amounts, but it's based on the income that was reported to the IRS 2 years prior to 2021. So that's for 2023. So someone who retires, yes, they are giving us the amounts. So these are the IRMA amounts for people whose earnings are greater, if it's individual and their earnings are greater than $97,000 a year, but less than $123,000, they pay $230.80. If they're a joint tax return and it's greater than 194, but less than 246, they paid the $230.80. So this chart is available, and this is the chart that would apply to everyone. You might be able to help your customers by telling them, some people when they retire, because of what they're receiving, their distributions for stock and all those things, their income could be substantial. So yes, they're going to pay more than $164.90. Just understand that $164.90 is not the premium that everybody pays, but it is the premium that most people pay. So you can always pull up this chart to show them if they're interested in knowing what their Part B premium might be. I have a customer who won the lottery, and she applied for Part B, and of course, because she had the distribution that year, they wanted to charge her an exorbitant amount per month. So she stayed at work, stayed under the employer plan for 2 years, and she'll be retiring next year. Okay, moving right along. You can still see my screen. Payment mechanisms and penalties. Part B premiums may be deducted from Social Security checks, from railroad retirement checks, or Office of Personnel Management civil service annuity checks. If an individual does not get these checks, they will get a premium bill from Medicare every 3 months. Employers may pay the Part B premium on behalf of retirees. For individuals who do not enroll in Part B when first eligible, the Part B premium is increased 10% for each full 12-month period the beneficiary could have had Part B but did not enroll. This is known as a late enrollment penalty. You'll see LEP throughout your course material, throughout your exams. LEP, late enrollment penalty. It's because they didn't take Part B when they should have. It's 10% for each full 12-month period the beneficiary did not have Part B. The exception to that is individuals who have group health coverage based on their current employment or employment of a spouse, or are subject to premium increase penalties if they enroll in Part B anytime while covered under the group health plan or during the special enrollment period that occurs during that 8-month period when they can leave the employer plan. They are not subject to the penalty. And this is an example of the penalty. Ms. Klein plans on retiring in March. She's 72 years old, but has never enrolled in Part B coverage because she has an employer plan. She will lose her group plan upon her retirement. So Ms. Klein has until November, which is 8 months from March, to enroll in Medicare Part B without a late enrollment penalty. Example 2, Mr. O'Hare, who is 70 and does not have Part B, is retired, but he has health coverage through his wife's current employer. If Mr. O'Hare decides to get Part B while the group coverage is in effect or within 8 months after his last month of coverage, he can do so without incurring a late penalty. Bottom line, if they're covered under an employer plan that is creditable coverage, and every year that employer plan gives the employee that letter that says you have creditable coverage. So as long as they have creditable coverage, then when they leave the employer plan, they have 8 months to get Part B without penalty. Help for individuals with limited resources. This is where we talk about how people get assistance. Beneficiaries may qualify for help to pay for Medicare Part A and Part B, the Part A and Part B deductibles and cost sharing, and some Part D prescription drug costs. They may qualify for the following programs by applying to the state Medicaid office, Medicare Savings Program, and you'll notice if you ever go in to apply for low-income subsidy for someone through Social Security, they'll ask you the question, do you want us to send this information to the state for the Medicare Savings Program? And you should always say yes. Or in Florida, it says don't fill it in, don't put a check mark if you want us to do it, and then they automatically send it to the state Medicaid office. The Qualified Medicare Beneficiary Program is one type of Medicare savings program. Qualified Medicare beneficiaries enrolled in Medicare Advantage plans also get help with their Medicare Advantage cost sharing amounts. That's your QMB level. Part D, low income subsidy, also known as extra help, gets help paying for prescription drug. Now, those are two different things. Low income subsidy and Medicare savings are not the same, but one person can have both. Persons who do not qualify for the Part D low income subsidy, but are of limited means, may qualify for help in paying for Part D drug costs through a state's pharmaceutical assistance program. Medicaid, help with healthcare costs not covered by Medicare, such as custodial long-term care. Beneficiaries with limited income and resources should be encouraged to apply to their state Medicaid office. Many of us have helped people to apply. When you apply online, here in Florida, it seems to move faster. You just have to stay in touch with your customer to make sure that when they get the letter, that they notify you. Because if not, I don't know how other agents find out, but those telephone people will find out and they'll call them and have them enrolled immediately. It's happened to me. I just don't understand it, but it happens. Agents should tell beneficiaries who may be eligible to call or visit their Medicaid office and ask for information on Medicare savings programs. So you can get the number. Google is your friend. Google the number for the state office, or they can start with 1-800-Medicare. Okay, let's look at Part A, inpatient hospital care. Includes care for acute care hospitals, critical access hospitals, inpatient rehabilitative services or facilities, and long-term care hospitals. Part A also covers blood, covers up to 100 days of home health care after an individual is in a hospital or skilled nursing facility. And this is different now from Medicare Advantage plans. Medicare Advantage plans don't require inpatient hospital stay prior to skilled nursing stay, but original Medicare does. Key point. Skilled nursing and rehab care up to 100 days, but only after a 3-day hospital stay. Inpatient psychiatric care up to 190 days lifetime. So where your medical hospitalization inpatient days are annual or per visit, I'm sorry, your inpatient psychiatric care is lifetime. Part A also covers hospice care. These are all things that you probably already know. In 2023, beneficiaries paying the following amounts for inpatient hospital covered under original Medicare. $1,600 deductible. So the thing that always happens to us every year, remember, is we don't know what the 2024 deductibles for Medicare will be until around October, really. It may come out sooner this year because everything's moving faster, but we generally start when we have finished our certifications and order your initial supply of sales materials. They will have the STARS rating from 2023 and the deductibles for Medicare from 2023 until those numbers are published and until the new STARS rating for 2024 are issued, and that's generally around November. And when it's done, you must start to use the 2024. So it's $1,600 deductible for each benefit period, day 1 through 60. You have no copay after that deductible, but then starting with 60 days, 61 to 90, there's a $400 payment per day for each benefit period. So that actually means each hospitalization during the year. For days 91 and beyond, it's $800 copayment per day for your lifetime reserve days, and after day 90 for each benefit period. Lifetime reserve days are days a beneficiary may use after they've been in an inpatient hospital, medical hospital for 90 days. There are no days beyond the lifetime reserve days. So then the beneficiary is paying full cost of care. In 2023, beneficiaries paid for convalescent skilled nursing under original Medicare, days 1 through 20, $0 and days 21 through 100, $200 per day, and days 101 and beyond, 100% of the cost. Original Medicare only covers up to 100 days. Medicare Part B. Medicare Part B, of course, just to reiterate again, your physician and other healthcare professionals, outpatient hospital services, clinical labs, diagnostic tests, x-rays, MRIs, CAT scans, durable medical equipment, home health care that's not covered under Part A because the person was not in a hospital or because they've exceeded their 100 days under Part A. Physical and occupational therapy, ambulatory surgical center services, chemotherapy provided on an outpatient basis. Those are all covered Part B expenses. Ambulance services, chiropractic services, opioid use disorder treatment, e-visits, diabetic supplies, kidney dialysis, outpatient mental health care, certain telehealth services, continuous positive airway pressure devices are also Part B covered expenses. In 2023, the annual deductible for Part B is $226. And after that deductible, the plan pays 80% of covered medical expenses, and the Medicare beneficiary pays 20%. There is no stop loss in the 20%. There is no cap. There's no maximum on that 20%. Preventive services are covered under Part B, and under Original Medicare and Medicare Advantage plans, there's no cost sharing for most preventive services. So, one-time welcome to Medicare physical exam and annual wellness visit after 12 months enrolled in Part B and annually thereafter. Vaccines such as pneumonia, hepatitis B, flu shots, COVID, all the vaccines are now covered as preventive services with no out-of-pocket costs. Bone mass measurement every 24 months, PAP tests and pelvic exams every 24 months, every 12 months for those at risk, diabetic self-management training, smoking and tobacco use cessation counseling, glaucoma testing once a year for those at high risk. These are all preventive services that are covered under Part B with no copay. Now, these are the things that are not covered by Medicare, Original Medicare, Parts A or B. Healthcare while traveling outside the United States, cosmetic surgery, custodial long-term care, outpatient prescription drugs, because that's covered under Part D. Most dental services, although Medicare will cover diseases of the mouth and tissues of the mouth, but nothing to do with the teeth. Medicare does not cover hearing aids, massage therapy, eyeglasses, concierge care, or covered items or services provided by a doctor or other provider who is opted out of Medicare except in an emergency. Original Medicare and Part D prescription drug benefits. A beneficiary in Original Medicare may receive Part D prescription drug coverage through a standalone prescription drug plan, generally except for those duly eligible for Medicare and Medicaid. Medicare beneficiaries must actively select a Part D plan. So if someone has Medicare and Medicaid and they have not selected a Part D plan, a plan will be selected and assigned to them. Beneficiaries who enroll in Part D typically pay a monthly premium, an annual deductible, and a per prescription cost sharing. In selecting Part D, beneficiaries should consider overall costs, which would include the premiums, the cost sharing, the formulary, and the network pharmacies. Appeals related to original Medicare Part A and Part B and payment determinations. Beneficiaries receiving Part A and or Part B services have a right to appeal Medicare coverage and payment decisions. Beneficiaries should look at their Medicare summary notice. The summary notice shows Part A and Part B services and supplies that providers and suppliers billed to Medicare on their behalf. The Medicare summary notice also shows what Medicare paid on the beneficiary's behalf. It will show the amount billed, it will show the amount that Medicare approved, and it will show how much of the approved amount Medicare actually paid. Beneficiaries can track their Medicare claims or view electronic Medicare summary notices by visiting mymedicare.gov. Beneficiaries must file an appeal related to A or B services within 120 days of the date that they get the Medicare summary notice in the mail. The appeal should be sent to Medicare administrative contractor, to the administrative contractor who processed their claim. And instructions for filing the appeal can be found at medicare.gov. If a beneficiary disagrees with the decision on the appeal, they have 180 days after getting the decision notice to request a reconsideration by a qualified independent contractor. Fast appeals. Beneficiaries receiving Part A and Part B services through original Medicare have a right to a fast appeal. This includes services provided by a hospital, skilled nursing facility, home health agency, comprehensive outpatient rehab facility, or hospice. The provider will give them written notice before the end of their services. The notice tells them how to act for a fast appeal. Grievances. Beneficiaries may file complaints about their Medicare provider or the quality of care they received. And you all know, as licensed insurance professionals, they can also file complaints against you. Be careful. Medicare beneficiary may file or have a complaint about unprofessional conduct by a provider, improper care, unsafe conditions, abuse by a provider, long waiting times, or unclean conditions. Instructions for filing a grievance is at www.medicare.gov. Claims appeal, how to file a complaint. There are some additional beneficiary protections under original Medicare. Medicare operates a 24-hour helpline at 1-800-Medicare. Beneficiaries can use this number to find out about their claim status, coverage and benefits, premium payments, or to ask other questions about Medicare. Beneficiaries can also get assistance with Medicare, including help filing an appeal or grievance through their local state health insurance assistance program, which is SHIP, which I understand as the new rule, we will need to include in marketing information that beneficiaries can use SHIP. For more information about Medicare, you can go to www.cms.gov, www.medicare.gov. You can look at the Medicare and You Handbook, which you can download. You just Google it, Medicare and You Handbook 2023, and you can download it as a PDF. Medigap coverage. This is your Medicare supplement plans. As you know, all the Medicare supplement plans are going to be the same. Plan G is going to be Plan G no matter what state it's in. The only thing that differs in the Medicare supplement with the carriers is the premium, how the premiums are calculated, and the extra benefits or discounts that the carrier may include in their program. So Medicare supplements are sold by private insurance companies to fill the gaps. So this is where, as an example, on Part B, the 20% has no cap if someone just has original Medicare. The Medicare supplement picks up the 20% for the person. So instead of them having that liability or that potential out of pocket, they pay the premium for the supplement, and the supplement picks up the 20%. So some Medigap or supplement programs limit benefits not covered by Part A or Part B, such as extra days of coverage for inpatient hospital, but generally, most of the supplements will cover the extra days, at least 365 days. However, they will not cover long-term care, vision or dental, hearing aids, eyeglasses, or private duty nursing. The Medicare supplement plan is not a Medicare Advantage plan or other Medicare health plan. It's not original Medicare, but it does follow original Medicare. It supplements original Medicare benefits only. So a person can only have a Medicare supplement if they're using original Medicare Part A and B as their base health coverage. They cannot use a Medicare supplement with a Medicare Advantage plan. And you can be in jeopardy if you sell someone a Medicare Advantage plan and a Medicare supplement plan. It is illegal. Medigap plans are standardized, as you all know, and they have the letters from A and N, and G is the most popular, and then N, but you may be able to sell some of the other plans. In some states, people who are under 65 are only allowed certain plans, like A, they're not allowed to purchase G. So you have to know what is available in your state. All Medigap plans pay for some or all of the following. So they're all going to cover the Part A coinsurance or part of it. They're going to cover the 365 additional hospital days, which I mentioned. They're going to cover the coinsurance or copay for Part B. They're going to cover the blood, first 3 pounds, and they're going to cover hospice care if there's coinsurance or copayments. If an individual still has a Medigap plan H, I, and J, these plans are no longer sold. So they're not available after January 1, 2006. However, some beneficiaries may have decided that they were going to keep them. If they did, by this time, they should also have a Part D prescription drug plan. People who enrolled in Medigap plans may only obtain Medicare drug coverage Part D plans through a standalone prescription drug plan. Before 2006, plans H, I, and J included prescription drugs. To enroll in a Part D, the individuals who have Medigap plans H, I, and J may keep their Medigap coverage with the drug portion of the coverage removed and enroll in a Part D plan, or drop that Medigap coverage and enroll in an MAPD, or enroll in another Medigap plan, like a Plan G, and then buy a standalone Part D plan. Non-Medicare insurers are required to notify beneficiaries. I mentioned this earlier. The employer plans must notify beneficiaries every year that the prescription drug coverage that they have is credible. And credible means that that coverage is expected to pay, on average, at least as much as the Medicare Standard Part D coverage expects to pay. Most employer plans are going to be creditable because, first of all, they don't have the donut hole. So they will cover drugs throughout the life of the person who's covered under the plan without going into the donut hole. And the Medicare model for prescription drugs does have the donut hole. So the employer plan does pay at least as much or greater than what the Medicare Part D coverage pays. All beneficiaries who do not maintain credible coverage must pay a Part D late enrollment penalty if they wish to enroll in Part D, unless they qualify for extra help, the low-income subsidy, or they enroll in Part D during a special enrollment period for loss of credible coverage. Beneficiaries who previously had credible coverage and are informed that their non-Medicare drug coverage is no longer credible will have a special election period to enroll in a Part D plan. Medigap rules for people who become eligible for Medicare after December 31, 2019. Clear and simple, anyone who's becomes eligible for Medicare, they become age 65, January 1, 2020, or after, cannot have Plan C or Plan F. Anyone who was 65 prior to January 1, 2020, who has Plan C or Plan F, can continue to have it. But any new individuals as of January 1, 2020, who becomes age 65, Plan C and Plan F are no longer available. This is a chart of the Medicare Advantage plans and the differences in the benefits. I'll give you a moment to look at that if you like. Okay, Medigap plan case study. Mrs. Jackson just turned 65 and became eligible for Medicare this year. She's considering a Medigap plan. She says that she feels more comfortable paying a higher premium to avoid substantial cost sharing each time she receives a service. The agent explains that Plan C and F, which cover 100% of the Part B deductible, are not available to her because she became eligible after January 1, 2020. However, plans D, G, or N are most likely to fit the bill. For more information on Medigap, you can go to www.cms.gov or look in the 2023 Medicare New Handbook. We are now at the end of the course. I'm going to stop sharing and come back to look at all your beautiful faces and look at everybody who fell asleep. This is boring stuff.
I'm
I
so
know.
sorry.
I know it
didn't know
is.
I know my mic was open.
I mean, it can't, see, I told you. I was gonna find somebody falling asleep. It is boring, but let me tell you, now you're through with module 1. When you go into AHIP, you are ready to go to the practice quiz, and you do have that option. Now, if you start where I started, you're gonna have to go through each one of those slides. But the reason we're doing this together is so you don't have to go through each one of those slides. You go right to the practice test. And tomorrow, before we start module 2, I'll answer any questions you had that, you thought you had it right on the practice test and it wasn't. And you could do the practice test as many times as you'd like. In the past, they've also, on the practice test, they tell you what the correct answer is. So sometimes you'll look at it, you'll see that you had the wrong one, and they'll tell you which one was the right one, and you'll say, oh, that makes sense. But we'll spend just a few minutes before we start module 2 to see if there are any questions, anything that you don't understand. Does anybody have any questions from tonight?
I do, Faye. I had a question and a comment with regard to it being illegal to sell somebody a med sup and an MAPD. I learned this from experience the hard way. If they're in a med sup and you enroll them in an MAPD, the client has to call and cancel that med sup. Otherwise, they'll keep billing them for it.
Absolutely, but
don't
that's
notify.
one of the things that you have to be absolutely certain. Now, you did not sell both of those. The client
Right.
had the supplement, but that is a key point. If you're going to sell anyone who has a supplement, and this generally happens during AEP. During AEP, and look for it more this year because more and more people, as they age, their med sup premium increases.
Mm-hmm.
And as that med sup premium increases, they can change the med sup, but they can't do anything with the prescription drug until AEP. And at AEP is when they will start to look at, maybe I should now look at a PPO, which is my suggestion that if you're going to move them from a med sup, take them to a PPO first. Don't put them in an HMO because that's like going from A to Z without ever stopping.
Now, my question was, what is Medicare Part B excess charge that the med sups are covering? I'm not familiar with that.
15%. All Medicare providers are allowed to charge 15% above what Medicare approves. Most providers do not, because it just becomes too tricky to bill. But they are allowed to charge 15% above what Medicare approves. So if the bill was $100 and Medicare approved 80, they can add another 15% onto that. And most of Plan G, of course, does pick up that additional 15%.
Thank you.
Any other questions? No? Okay. So I'll leave you to do your tests tonight or first thing in the morning when you're bright and early and sunshiny faces and stuff. And I will see you tomorrow evening. Thank you so much. If you think of any questions while you're going through the practice test, shoot them over. If I don't see it tonight, I'll see it tomorrow morning. Thank you. Have a good evening.
Thanks, Faye.
You're welcome.